Well, if you're looking outside of that window, looking at Tahoe, I think it's pretty clear to see that there appears to be a lot of fresh powder out there. And I believe that we have lost Matthew Holt. It's the January 26th episode of Health in 2.00. So what is this? You've come in for opera ski and health tech deals with me.
It's important that I show up for the show, and I'm not.
Oh yeah, really important.
Well, they're promising. They are promising a foot of powder for tomorrow or the next day. So very little chance
of health tech startups. No announcements, please, because the big guys got to hit the slopes. Get your timer ready. We have an avalanche of health tech funding deals to get.
Okay, here we go. Ready?
Very excited about this first one. Signify Health files for an IPO, like a real IPO, not a SPAC IPO. Tell me about them.
I assume they want to leave more money on the table then for the for those syndicates. All right. So Signify is an interesting mix. It's like a company that manages at-home care. With a network of nurses, and it also bought a bundled payment company from the Wiggins brothers called Remedy Health, Remedy Partners a while back. Carl Ambrester, former Signify Health corporate guy, corporate development guy, is the CEO, and they're in the sort of 400s of millions of revenue and getting relatively profitable if you believe their adjusted EBITDA number rather than the actual GAAP EBITDA number. So this looks like a promising start. Most of their revenue comes from United, Aetna, and Humana. So one of those things about how much of the health plan is going to do and how much they're going to outsource to these small tech companies. We'll find out.
All right, what do you mean? Cross-partnership deal between OneDrop-Bayer and SCOR. It's a life insurance product they're developing. Tell me what you know.
Not much. What do you know?
What do I know? Well, I know SCOR is the fourth largest life insurance company in the world. And I know that this is it's like the first time they're doing a chronic condition specific life insurance policy that's using OneDrop's platform and SCOR's like risk predictive platform. See what happens. I love the cross industry collaboration around this. Very cool. What about Lumiata? Do you know anything about that one? They raised 14 million, bringing their total to 45. This is a predictive analytics place. So kind of jumping off of that.
Yeah, they've been doing predictive analytics, like who out of your healthcare, out of your EMR has got diabetes that you haven't figured out, and they've been doing that for a while. They came very close to death a couple of times. Seemed to be they got new management in about a year and a half ago, and seems to be they're able to raise more money. We'll see how they do. They've been kicking around for a while. Hope they get somewhere.
All right, what about Neuroflow? They get 20 million in a Series A. Magellan led this round. Magellan just got acquired by Centene. This whole thing is very interesting in terms of mental health.
Okay, we're out on the timer. The rooster has crowed, but you got the question in first. So this is an interesting one. So Neuroflow, this is a sort of let's get the incumbents up to speed with their technology play. So basically, if you look at all of the companies that we've been talking about in terms of mental health, pretty much they're putting together their own networks, and they're putting together, all the different stuff that those networks providers need in terms of practice management, in terms of things like tests for CBT and patient management and patient engagement. The typical therapist out there hasn't got all that stuff, right? They sit there with their notebook and on the couch. And what Neuroflow do is going to those folks and saying, we've got all that in a box for you. And it's been doing pretty well as far as I can tell. And I talked to the CEO, Chris blank on his name, a while back, and it seemed pretty smart. And they raised about, I think, 10 million before, and now they raised another 20. And just another play in the mental health space, but this one is a little bit nuanced, a little bit different, and trying providing stuff for the incumbents who really need it.
Interesting times. Nice mix of deals in there. I liked all that.
Yeah, I mean, I think that life insurance one is interesting. Not that I know squat about it, but the couple of Japanese and Asian life insurance companies went with a couple of those one with NeuroTrack and one with Savonix. I don't know what's happened to them, but the idea was they're selling life insurance, and the longer they can keep people alive and healthy, the better. I think it's the same principle with the OneDrop one.
Yeah.
The less they have to pay out. Therefore, they get the money now, and they pay out when you die. And the longer they can push that out, the better they do. So I think that's what the idea is here, and that's a little bit of an interesting view compared to the typical. Can we do this sort of chronic care management and stop people costing so much now or in the next year? So, I mean, it's interesting. I can't see it being a dominant, play in healthcare, because in the end, the people who want to save money in healthcare are the people who are paying for it now rather than paying for it in 30, 40 years. But, you can start to see people thinking longer term, which is good.
I think it's cool that they've taken the health data out of healthcare in this case and are applying it into a different industry. I think that that's really interesting to me, like how that all might have potential in other markets and other industries later on. I think the more we get, the better we get at managing our own data in healthcare, and the more valuable we prove it to be, the more stuff like this you're going to see where it's cross-industry collaborative.
Well, I wonder if they'll come in. I mean, I have life insurance. I got it when my son was born, and for 20 years, he's 6 now. So I got my family has 14 years to knock me off, basically.
Just send in ideas about how to know it.
I'm frankly, I'm surprised I'm still alive. They just haven't figured out how to pull off the perfect crime yet.
Oh my God, seriously. It probably is not for lack of trying. If you too want to find out how it is that Matthew Holt is still alive, just follow him on Bolty Boy. It really is pretty amazing that nobody has knocked you off yet from either within your household or without. I'm sure there's a lot of health tech
I might be buried under a snowdrift in the next few days. You never know.
I think that there have been a lot of health tech entrepreneurs who wished they could have done something to you along the way. But yeah, follow him on Bolty Boy and find out why. And you can follow me at Jess on Twitter. I'm talking about all sorts of stuff. I had a big week last week. I interviewed the CEO of Hinge Health, and I interviewed the CEO of Hims and Hers. So be sure to check out those interviews.
I have a forecast for you. I think Hinge, Teladoc, because their stock has gone crazy again this morning.
Oh my God, crazy.
I mean, it was up to, we did the calculation. So when Livongo was acquired, it was at 150. And the calculation now is that Livongo is worth, 160, 170 with the share it got, having gone all the way down, right? Because the Teladoc was at 250 at the acquisition and then went all the way down to like 160, 170. I bought a bunch, sold it at like 212 because of what I was being clever.
Who's clever?
Yeah, we know that you are the Wall Street bets, stock trading, GameStop, Tesla, acquiring stock queen. One day when the music stops, we'll all look clever or not.
I don't know about that, but yeah, Amwell's up too, 10% today, or at least it was earlier when I checked.
Well, but if you look at that, they're worth so much more than that. 35, 38, $40 billion or something. They've got some holes left. Musculoskeletal is one of them. Hinge Health, as you in the interview you had, has a big chunk of that market. They remember a $3 billion valuation. Wouldn't surprise me to see them stick, 6, 7, 8 billion in stock, acquire that, buy their.
Teladoc, you're saying?
Yeah, Teladoc might buy them because the question is, who else do you buy? Do you buy Kaya, or do you try and build it out internally? I think you've got to do something with that huge stock price you got. Same with Amwell. Although you were telling me yesterday that Amwell was going to get bought by United.
Yeah, the rumor on the street is that United Health Group is going to acquire Amwell.
They have done that deal with them. They did that virtual primary care deal with them, and not with Teladoc, when they were a big customer.
Right.
Yeah. So
I believe we're arming up, right, to go head to head with we said that when that Teladoc Livongo deal closed, was that it was going to be them competing with Optum, and here we go.
Yeah. Well, probably. Very interesting.
Right, well, let's get out of this. So go subscribe for our newsletter, because there's a lot more chatter and BS like this in there. You can go find that over on the healthcareblog.com. Just look for the email newsletter subscription box on the right hand side. Sign up to get our Health in 2.0's, our WTF Health interviews, and all the other stuff that's curated from the blog over the course of the week, delivered directly into your inbox on Thursdays, unless somebody forgets, and then it's on Fridays.
Well, it was a good ski day. What am I going to say?
Yeah. And we'll just let this guy go and hit the pout again. So we'll talk to you guys soon. Thanks so much for joining us. We'll see you later. Bye.